Secret vitamins to shrink an enlarged prostate. Prostate enlargement is a medical condition characterized by the prostate gland growing bigger with age. It's also known as benign prostatic hyperplasia, or BPH. Almost every man undergoes prostate enlargement as they get older, particularly after age 50. Research indicates that over 90% of men aged 80 or above have this condition, and many men aged 40 have slight prostate enlargement. But prostate enlargement isn't a sign of cancer or has no link to it whatsoever. The risk for prostate cancer is equal in two men, one with an enlarged prostate and another with normal prostate. This gland is a vital part of the male reproductive system. It is situated below the bladder, which holds your urine, and above the pelvic floor muscles. The rectum is located behind the prostate, and it is possible to feel the gland through the rectum with a finger. At a young age, the prostate gland is pretty small, about the size of a chestnut, but as you age, it expands naturally. The urethra in men carries their urine from the bladder out of the body. Your prostate gland is wrapped around the urethra because its ducts open into it. Urethra is the main tube that collects fluids and sperm cells from all the glands and testicles to form semen. The prostate gland has connective tissues containing many smooth muscles and elastic fibers. It has multiple smooth muscle cells inward that contract and forcefully expel the fluid stored in the prostate into the urethra. The sperm cells move from the testicles through the sperm duct, and the fluid from the prostate and other glands combine to form semen in the urethra, which is then released. Simply put, the prostate gland plays a crucial role in forming semen and supporting the process of ejaculation in the male reproductive system. The actual reason for prostate gland enlargement isn't clear yet. Still, some studies suggesting that aging factors and changes in the cells of testicles and testosterone levels can be a reason to initiate or accelerate this growth. Once the prostate gland starts to grow or get swollen, it begins to put pressure on the urethra and squeeze it, which makes it harder for you to urinate. An estimate suggests that less than half of men with this issue experience symptoms. The most obvious symptom of prostate enlargement is trouble with urination. The urine comes out like a leaky faucet, and your bladder does not empty in one go. You constantly feel the strong and sudden urge to go to the washroom like your bladder is full, even at night. But you don't urinate with a strong, even flow. In severe situations like infection, some patients may have pain while urinating or notice blood in the urine. In any case, multiple tests and exams are done to analyze the patient's situation. The treatment of this condition also depends on the medical history, symptoms, and severity of the issue. Multiple medications help reduce the size of the prostate gland. In serious cases, laser therapy or surgery is done to remove the extra tissues of the gland, which is better discussed with a professional doctor or urologist. Apart from that, there are some diet and lifestyle changes that you can follow to relieve the symptoms of an enlarged prostate gland. This video discusses the top 6 vitamins and lifestyle changes that can help you shrink your prostate gland and restore normal urination. So let's get started. Phytoster Rolls. The number 1 is Phytoster Rolls. Phytotherapy is considered a promising solution to manage the symptoms of BPH. Beta-sitosterol is a kind of phytosterol with a chemical structure similar to cholesterol. This natural micronutrient is found in higher plants and botanicals such as saw palmetto. Though beta-sitosterol cannot shrink the prostate gland significantly, it reduces the amount of urine left in the bladder and improves the urinary flow. In this way, you don't get the continuous urge to urinate, and your quality of life improves. Beta-sitosterol works great in men with mild to moderate BPH. Beta-sitosterol prevents the inflammation of the prostate gland. It suppresses the activity of an enzyme called 5-alpha reductase, a key trigger in the onset of BPH or prostate cancer. Moreover, phytosterols help to unclog arteries by preventing cholesterol from building up in the vessels. Some common sources of phytosterols are green peas, sesame oil, extra virgin oil, and pumpkin seeds. Zinc. The next is zinc. Zinc holds a special place in every man's body because the prostate gland accumulates more zinc than any other part of your body. Some studies show that proper zinc is mandatory to support prostate health and prevent tumor growth. The major benefit of zinc is that it helps shrink an enlarged prostate and improves normal urine flow. The prostate gland stores large amounts of this mineral because it helps to restore hormonal balance in men and reduce inflammation. Zinc stops the testosterone hormone from converting into estrogen or DHT because otherwise, it can be a leading cause of BPH. Zinc performs this vital function by suppressing the activity of enzymes like aromatase and reductase. The daily recommended intake of zinc is 15 mg per day. You can fulfill your daily needs by adding pumpkin seeds, oysters, nuts, beans, organ meats, watermelon, and sugar-free dark chocolate. You can take zinc supplements daily, but keep your copper level in check simultaneously because zinc depletes copper. Lycopene. Lycopene is a bright red carotenoid hydrocarbon pigment in berries, tomatoes, watermelons, and other fruits. Lycopene is known for its antioxidant properties that prevent chronic diseases such as heart attack, diabetes, and Alzheimer's. It preferably gets stored in the prostate and inhibits the growth of normal epithelial cells of the prostate gland. Lycopene helps avoid and manage BPH by the induction of apoptosis, promoting gap-junctional cell communication and inhibiting insulin-like growth factors. Men with BPH, prostate cancer, or inflammation have more than normal protein-specific antigens in their blood. Studies report that lycopene lowers the levels of PSA by stimulating the cell progression inhibition of the prostate gland. Further, it reduces the risk of prostate cancer by strictly maintaining testosterone levels. Eating a lycopene-rich diet is very crucial for aging men as their testosterone level drops with age, leading to high estrogen levels and enlarged prostate gland. Some studies indicate that eating heat-processed tomatoes compared to raw tomatoes is more useful. Heat makes them 4 times more bioavailable so they can be readily absorbed. Vitamin C. Oxidative stress can be a contributing factor to prostate expansion. This is why vitamin C is a potential source to prevent prostate enlargement. It has rich antioxidant properties that protect prostate cells against oxidative stress caused by harmful free radicals. Vitamin C also suppresses the expansion of a molecule called HIF-1 alpha, which can stimulate the growth of the prostate gland. Vitamin C is also called ascorbic acid. It has multiple health benefits and is essential to your daily diet. Plant-based foods such as vegetables, fruits, salad leaves, and berries are rich sources of vitamin C. For a more accurate idea, you can take cabbages, strawberries, oranges, bell peppers, and cruciferous vegetables to boost the antioxidant effects in your body. Vitamin C prevents oxidative damage and inflammation, which can lead to prostate cancer. It regulates the production of the cortisol hormone that otherwise interferes with other hormones and possibly triggers a hormonal imbalance. It is important to note that ascorbic acid supplements possess only 5% of the vitamin C complex, so overintake can cause side effects. Still, whole fruit supplements are more beneficial in this regard. Green tea. Number 5 is green tea. One of the most commonly used and readily available items to keep the prostate gland in size. It has strong antioxidant properties that reduce the levels of dihydrotestosterone, a hormone that promotes the growth of the prostate cells. Epigallocatechin 3 gallate is a catechin commonly found in green tea. These natural antioxidants prevent cell damage and provide other benefits. By reducing free radical formation in the body, these substances prevent damage to cells and molecules. EGCG is one of the most powerful compounds found in matcha green tea. This compound is mainly responsible for the medicinal properties of green tea. A study suggests that men who drink green tea regularly have lower risks of advanced level prostate cancer. EGCG inhibits the activity of 5-alpha reductase that promotes BPH by converting the testosterone hormone into DHT. Take 3 to 4 cups of green tea daily for a significant reduction of the inflammation in the prostate gland that eventually heals and shrinks back to its normal size. Lauric acid. Lauric acid is found in various vegetable fats, palm kernel oils, and coconut. This medium-chain saturated fatty acid is useful in shrinking the hormonal-induced enlarged prostate. A high level of DHT means that the testosterone level has reduced in your body, which stimulates the expansion of the prostate gland. But lauric acid reduces the DHT level and helps you to bring your prostate gland down to its normal size. Young men can also add lauric acid to their diet to prevent prostate enlargement. Some inflammatory cooking oil can worsen your prostate gland, so it is better to cook in raw, unprocessed coconut oil. The primary fatty acid in coconut oil is lauric acid, which makes up 35 to 50% of the coconut oil. The metabolic and physiological properties of coconut oil mainly come from lauric acid, so adding it to your diet early in life is recommended. Apart from these vitamins, here are some lifestyle changes you can follow to improve your quality of life and speed up your recovery from BPH. Once you start noticing the symptoms of BPH, immediately consult your doctor so they can diagnose the severity of your condition and prescribe medications such as 5-alpha reductase inhibitors. Though it is impossible to prevent BPH, it can be treated, and its symptoms can be alleviated with some diet and lifestyle changes, such as, if you are dealing with BPH, avoid liquids 2 hours before bedtime or going out. Similarly, limit the intake of caffeine and alcohol because they stimulate the urge to urinate. Avoid inflammatory foods, eat a low-fat diet, and have proper vegetables and fruits including citrus fruits daily. Plus, engage yourself in moderate to high-level physical activity daily to maintain a healthy weight. These lifestyle habits not only lower your risks of BPH, but also lower your chances of diabetes, erectile dysfunction, and heart disease. So did you find this video helpful? If yes, then hit the like button. Subscribe to our channel and press the bell icon for more informative videos on health and wellness. Till next time, goodbye and take care.